Ascending tracts. The spinothalamic tract is a sensory pathway which is observed from skin to the thalamus. From the ventral posterolateral nucleus in the thalamus, sensory information is relayed upward to the somatosensory cortex of postcentral gyrix. The spinothalamic tract consists of two adjacent pathways, that is anterior and lateral. The anterior spinothalamic tract carries information about crude touch, while lateral spinothalamic tract conveys pain and temperature. In the spinal cord, the spinothalamic tract has somatotopic organization. This is the segmental organization of its cervical, thoracic, lumbar and sacral components, which is arranged from most medial to most lateral respectively. The pathway decussate at the level of the spinal cord rather than in the brainstem like the posterior column. The medial lemniscus pathway and lateral corticospinal pathway or corticospinal tract. The axons of this tract cells crossover or decussate. Crossover means decussate to the other side of the spinal cord via the anterior white commissure and to the anterolateral corner of the spinal cord. Hence, the spinothalamic tract being part of the anterolateral system. Decussation usually occurs 1 to 2 spinal nerve segments above the point of entry. This is very important. When this decussation is always observed or usually occurs 1 to 2 spinal nerve segments above the point of entry of that nerves. It traveling up the brainstem, the tract moves dorsally. The neurons ultimately synapse with third order neurons in several nuclei of the thalamus, including the medial, dorsal, ventral, posterior, lateral and ventral posterior medial nuclei. From there, signals go to the cingulate cortex, the primary somatosensory cortex and insulator cortex respectively. When we see, there are two types of sensory fibers connected to the receptors. A beta that concern with muscles, joints and these are fine tactile, while A delta and C fibers concern with the pain, crude touch and temperature.